Well, what I spend my weekends doing is marshalling for motorsports. I tend to do it for fairly local clubs because I like being part of a community, being part of an organisation of people working together to do something, but it's great fun as well. When I first heard of the Yorkshire Health Study, I got something through the post, a questionnaire to fill in about my health, my background, what I eat, my lifestyle. I tried to be as honest as possible. And then I've had further different questionnaires asking about different aspects based on that original information. The most recent was something rather unusual when it comes to surveys. Instead of being just a bit of paper to fill in, it was I got a mobile phone through the post with some questions to answer, and you filled it in as if you were doing a text-based response, which I thought was an unusual and innovative way of capturing information.
The name of my project is the Mode of Administration Study. What this study is all about is comparing different methods of collecting patient questionnaires from using either mobile phones or using pencil and paper methods. The reason why we're testing these methods is because with the new developments in mobile phone technology, it's possible to collect data using these mobiles or iPads or tablets or the internet, and these offer various benefits to pencil and paper methods. So we're testing and comparing the different methods to see which one offers the most advantages.
I got through the post an envelope with a phone in, very light, just an ordinary phone, and I got some questions to fill in, and I just followed the instructions. It asked me a few questions about health issues, and I just pressed the buttons. It was very easy to do. It was very fast, and then I filled it in, sent it off. I just thought as a way of gathering information, it was a different way of doing it. I was pleased to be asked because if by filling it in with my age, I can say that yes, I found it very useful and easy to use, then that shows that it's not something just for younger people, that everybody can use it once they've been shown how to do it. You know, it's not something that's age specific.
Measuring patient quality of life, measuring patient satisfaction with their treatment is a really important area of care. If this can be done at their convenience using mobile phone methods, it means the data can be stored instantly. The results that the patients provide can be instantly fed back to clinicians to inform clinical decision making straight away, rather than pencil and paper methods, which, for example, would have to be entered. And then the process of actually using that to inform clinical practice is going to take longer. The Yorkshire Health Study has been really useful for us in this study because it provides a really useful pool of respondents in the local area who have agreed to take part in research studies. So it's possible for us to actually send out the phones to them and ask them to fill out the questionnaire and get a really good response rate because they're open to taking part in research, which is really useful for us.
One thing about the Yorkshire Health Study, I didn't know anything about it when I started, but it's quite good to be involved in something that's growing and expanding. So I'm quite happy to be part of something that's going to tell something to the people who need to know about developing services about Yorkshire and what Yorkshire people need. I mean, I'm only one person, but if there are lots of people like me, all together we'll build up enough evidence so that we can say what is important to us in the way that services are delivered.